Hi everyone, today we have Dr. Lakshi Kumaradasa with us at the studio. So a small introduction to Dr. Lakshi. So Dr. Lakshi is a student, a pre-intern from Vitebsk State Medical University, Belarus. Just completed her exams and she'll be hoping to go for her internship pretty soon, and we will talk a few things. And also we are here today to discuss about her own experience in Belarus and about medical education. Hi Lakshi, welcome to the studio. So tell a little bit about Belarus and the education, Lakshi. How do you look at it and what do you think about it?
So when I started my studies at Belarus, I did not know much about the country. But to be honest, it's a very peaceful country, I would say. And it is a very safe country for a girl. And talking about the educational system, so the duration is 6 years. And so the first 3 years you learn your basic sciences, and the rest it's totally clinical years. At our university, which was Vitebsk, they expected us to have like 100% attendance. In that way, it's quite strict. You need to like go on time. If not, you have to like repeat the classes, likewise or pay to the university.
Sorry to interrupt, but then again, say I studied in Vitebsk as well.
Okay.
So when we studied, I graduated in 2013. So when we studied and I spoke to Dr. Lyon on another episode, and even she did mention that she graduated in 2019. So even she did also mention that Vitebsk, in my own experience, after third year, most of the subjects were taught in Russian, and we took the histories in Russian is okay, acceptable.
Yeah.
But apart from that, subject matter is taught in Russian, and MCQs what we set for was in Russian. Most of the practical exams were in Russian, theory exams were in Russian, all that. It was like when you study first 3 years Russian as a subject, it was okay, manageable. But then again, it wasn't very much. I wouldn't say it's 100% English medium curriculum. When you graduated, that is like 2021, isn't it?
2022.
2022. So last year. So what do you think about your curriculum? When did they start actual English medium, or is it already started, or it's not?
So they started like complete full English medium in from 2021. That's
Okay.
our immediate batch.
So past 2 years only they've been
yeah,
having it
yeah,
in English
yeah,
at the moment.
yeah.
Okay.
Yes.
So before that you never did any subjects.
No, we
so
had to. We did everything in English medium.
So just 2 years.
Yes.
Okay. All right. So why, Lakshi, when it comes to population in Belarus and everything, when you look at, what do you think about the clinical exposure? Which faculty, or there are 4 universities in Belarus where they're located, all 4 are under Medical Council of Sri Lanka as well. So which faculty, in your opinion, would have a greater clinical exposure, you think?
So it depends on the population. So if it's highly populated, like they will have more hospitals, and especially if you are going to university which is in like the capital, obviously the facilities, everything will be much more better. So in Vitebsk we had around 19 hospitals, and our clinical exposure was quite good because we had like, even during COVID times, we had a lot of patients, and it was like,
so approximately Vitebsk has around 1 million population, around 19
Correct.
hospitals. Whereas when it comes to Belarusian State Medical, there are around 70 hospitals and clinics to practice, and you have around over 3 to 4 million of a population. So
Yeah.
obviously the bed capacity is higher. So that makes that faculty also being 745 global ranking system, and also being the #1 national and state medical university in Belarus, and the first established medical faculty in Belarus as well. It's around 102 years of history. Not any other faculties are not even 30, 40 years closer. The next one can be around 70, then the 40 and 30 likewise.
Mhm.
So then this will be around 102 years of a history. And apart from that, and how, the safety wise as a girl, you already said it's safer. So what are the ground rules when it comes to hostel?
So we need to like be at hostel before 11.
Okay.
So, and we can't leave during that period, and if we come late, we need to like give the excuse as to why, and they will write our names down. It's like a big deal for them. They are like pretty strict.
But there are students who lives in the apartment as well.
Yeah, correct. So as long as you live in the hostels, you are like pretty safe. They know when you are going out and you are coming back, they take full responsibility. So yeah, but even though you live in an apartment, like people wouldn't, like, I don't know, during my stay, I have not heard
Someone
people
getting in
having
trouble.
trouble. Yeah.
Yeah. But then again, safety-wise, you're saying there's no significant
Yeah,
problems
yeah.
as such.
Even at 1 a.m., 2 a.m., you can safely walk, and nobody will come and do anything to you.
Trouble.
Yeah.
Okay. So when it comes to hostels to the university, the distance, what it is, how much, how early you have to wake up to go to the faculty.
So it's not walking distance for me because our hostel was a little bit away, a few kilometers. So it took like 15 minutes for us to go by a taxi. But if it's like a
So you're taking a bus, yeah.
Yeah, if it's like a bus, it will take around 20 to 30 minutes because we need to like get down, and from that place we need to like walk. It's like a 5-minute walk to the to the university. So
From the hostel to the bus stop, how long is the walk?
it takes like 2 to 3 minutes.
Yeah.
So altogether it will take like 30 minutes.
So you need
Total
to be
duration.
prepared accordingly.
Exactly.
It's not the premises which is located right around the university
Yeah,
itself.
yeah, but there are some hostels which are like right next to the university, but most of the students get the university which is like a little
That's
bit
the
away.
Pobedi Pyatha in where we stayed.
Yes,
What was your
Pobedi
room
Pyatha.
number?
Okay, it was 611 initially.
611.
Yeah.
Okay. All right. I studied in 503 as I remember. Anyway, so why Belarus, Lakshi? Out of all the faculties when you were about to go, why Belarus? Why did you choose Belarus as an option to study?
Yeah, so I had a lot of people. I knew a lot of people who were already studying in Belarus, and also there were many graduates who were like working around the world. That's one reason, and also I wanted to come back to Sri Lanka, so I checked whether it's SLMC registered, and it was also under AMC and GMC, which is UK. That part, and also safety, whether it's like whether the curriculum is in English, and the pass rates when it comes to ERPM.
Those were the main concerns.
Main concerns.
Understood. And so when it comes to when you went to Belarus, so did you know that there's going to be a faculty where there's 400 kilometers away from the airport, and how about when you felt first time when you traveled to Minsk, as in the capital city from your university, what was your thoughts?
It was amazing. Like Minsk is like the place that we plan. It's like a trip for us, Minsk. So it's like a amazing place. You can have everything there, starting from state of the art buildings to historical places like churches and gardens.
So
and
I heard a couple of students were saying, since you're located in the capital city and you have everything what you want, including metros to McDonald's to everything, but they're saying that's the distraction to study medicine. What is your thought?
I think if you have your priorities right and you are disciplined enough, if you know what, as I said, if you know your priorities, wherever you live, that's not a problem, because even in Vitebsk, you have enough and more bars and pubs to like go and do whatever you want. So I think it's just how you want to like live that life wherever you stay. So personally, I don't think
that's a problem.
That's a problem.
But anyway, when it comes to Minsk, none of the Sri Lankan students are staying away from the hostel. Everyone is compelled to stay in the hostels itself, so they can't stay in the apartments. So they have when it comes to hostel, like you said, they have strict protocols and controls.
Okay.
So in that, the students, of course, the smoking, drinking, this, that, everything cannot be tolerated. They don't tolerate, so you cannot use it as well. It's illegal. So that way, they keep it intact. That is also another advantage. But your thought about, what you would advise to a student who wants to go and study abroad medicine? What are the things you think a student should consider as a passed out fresh graduate? What is your opinion?
So you need to have a lot of discipline to go on time, and then somehow you need to work hard, one thing, and also I think you need to be flexible to adapt and adjust to whatever the environment, and you need to be patient throughout the 6 years, because it's a long journey and you'll have ups and downs, but you need to be focused. No matter what happens, you need to have a laser focus that this is where you want to go and work for it.
Good.
So doctor, according to your opinion, what are the countries that you would recommend for a student from Sri Lanka who's planning to pursue their higher education?
So actually, with around 10 years of me consulting students, I would say there is no one particular reason for a student to choose a country to study medicine. There are four main things. The first thing, they are going to look at the ranking of the university. Then the entry requirement, whether they have sufficient results to go to that faculty. Third thing is going to be like the budgets, if they have enough. And the fourth thing is going to be, is the university is recognized all around. When it comes to Sri Lankan Medical Council, not many universities are listed under Sri Lankan Medical Council, very few. Georgia, Tbilisi State Medical used to be under Medical Council of Sri Lanka, not anymore. You understand? So that is very significant. The same way, new universities coming up into Sri Lankan Medical Council also. Now, for an example, 2018 or 19, Yerevan State Medical University, Armenia came into Medical Council of Sri Lanka. So in that context, I can't even comment whether it's a good or bad university, because still not even one batch has passed out for us to comment. You know, it can be a good faculty, but then again, you evaluate the faculty once they complete, give foreign exams or come back, ERPM, or like, you know, once you start practicing, etc. So when it comes to Belarusian State Medical University with 100 years of history, the graduates are practicing in 101 different countries. You understand? The same way, not all the universities which are listed under Medical Council are good, and not listed under Medical Council are bad also. Because when it comes to Harvard, Oxford, Cambridge, NUS, Uni Melbourne, Uni Sydney, these type of faculties were never under Medical Council of Sri Lanka as well. So there is a significant guideline you need to maintain. So you cannot go to a faculty which is under Sri Lankan Medical Council with foundations, with diplomas. Sri Lankan Medical Council has a minimum requirement. So all those you need to look at. And also, if you're talking about budgets, if you're talking about UK, US, Australia, New Zealand, Canada, you're talking about 100 million plus for a direct medical university entry, including your food, accommodation, air tickets, all put together. You understand? So not just the budgets are low doesn't mean that, you know, you shouldn't go to the faculty also. But budgets are just low, that cannot be the only reason for you to choose that faculty also. So you have to make sure the ranking, the recognition, the entry requirement, and the budgets all will fall in one line. Then, like, you know, you should be able to comfortably choose a faculty to study medicine. So in that context, at the moment, out of the Sri Lankan Medical Council registered universities, all 4 universities in Belarus, the medical universities, are listed under Medical Council of Sri Lanka. The same way, Georgia none, like, you know, Armenia 1, then UK there are 3, Aberdeen, Newcastle, and Leeds. If you're talking about US, only South Carolina. Talking about Australia, only 2, Monash and Western Sydney. So very minimal university. So you need to be very particular if you're planning to come back to Sri Lanka as well. This needs to be fulfilled. And also, do not, I would recommend any student, do not go to a faculty with foundation, diplomas or a bachelor's. If your mother country, you're holding a Sri Lankan passport and you don't adhere to the SLMC guidelines, then you are in trouble. You can be in trouble upon completion as well.
Alright, so what is your thought? Like, a lot of students like want to go to countries like Armenia, Georgia. So like they used to come and ask me, doctor, like what do you have to say?
No, like I said, there are situations where students talking about like, you know, various countries, because that is again budget related, budget friendly faculties. But then again you have to look at how many have graduated from the faculty. If at least someone has completed from Sri Lanka from that faculty to even comment, your 4th year curriculum is going to be what? 5th year curriculum is going to be what? Now you said Vitebsk up to 2021, they didn't even have the program 100% in English. Obviously I witnessed it because I graduated from there. And like, you know, 2019, the doctors I spoke to, they witnessed it. They said they graduated from there, but then again, the 100% English medium curriculum wasn't there. As in, like, most of the subjects were taught in Russian. Eventually they have, like, you know, so for you to even comment that, you have to complete your program. Do you understand? So when you have not even completed, and also some of them used to tell me about the war situation in Belarus. So my opinion, the war situation from Belarus to where the war is going on, from the university to where the war is going on, around over 1,000 kilometers distance. That's not even Sri Lanka, India distance. Can be Sri Lanka and another faraway place above 1,000 kilometers. That's one thing. And the second thing is with the Belarusian population and the economy, I don't think in any way like they can support the war big time, or like even if they're planning to. War is unpredictable. In that context, if you look at Armenia and Azerbaijan is having a war for around 3 decades, and Armenia is a much smaller country bordering Iran and Iraq as one border, and that's the that they have a second largest US embassy is located in Armenia as well. So with a 3 million population, a tiny country bordering Iran and Iraq, and having the what do you call second largest US embassy says a lot then a war between Ukraine and Russia, and Belarus is away from it. You understand? So in that context, I don't know. I would not comment. But then if you talk to the students and see, like, the students are studying currently, and do like, did they have any significant impact, because this war has been going on for some time now. So when you were there also, it was there. So what do you think? You had any significant impact in your studies, or like in your traveling, or any of that, or safety? What do you like to say about that?
I mean, first of all of us were like very much excited. Our families in Sri Lanka, everybody. But Belarusians, they didn't take it like we did. It was like all cool for them, and it didn't impact us in a very bad way.
So there was any impact, as in what sort of an impact you refer? Any impact you had?
Like the banks and all, we didn't have like huge issues, but we had some limitations when it comes to.
So that limitation cash. Anyway from Sri Lanka also we had.
Also we had with the crisis.
Yeah, with the crisis, exactly.
Other than that, it was like okay.
Okay, so one final question, Lakshi, and on a, like, you have been to almost all the faculties in Belarus. Now you have already graduated and all that. So now you have a chance to choose among all the faculties between, say, all these Eastern European countries, and also mainly all 4 faculties in Belarus and all that. What would be your preference, and why you would choose that faculty? If you can make some changes, what would have been better?
Okay, so in considering everything, looking at the overall picture in terms of convenience, comfort and English, everything, I think I would choose BSMU.
As in the Belarusian
State Medical University, because it's located right in the capital.
Have you been to the faculty? Have you seen the faculty?
I've seen like on and off, but I've not gone inside, but I've seen the university, like when we go to
But you would prefer to live in Minsk, basically?
Definitely.
Okay, thank you. Thank you, Lakshi. Anyway, so we will conclude the session today, and we will have more sessions with Dr. Lakshi with her experience and how she prepared for ERPM examination, etc., etc. So you will stay tuned, and we'll get connected soon. Thank you. Thank you, Lakshi.
Thank you, Doctor.